Hello everyone and welcome back to the IPC in Action podcast. I'm Fran, one of the infection prevention and control nurses, and I have two very important guests for me today. Some will know Sophie from our last podcast. So Sophie, do you want to introduce yourself?
Hello, my name's Sophie. I'm one of the infection prevention and control nurses.
And we have an extra special guest, Harriet. Harriet, if you want to introduce yourself.
Hi, so I'm Harriet. I have a variety of roles. So I'm a dental hygienist and I work in the trust in oral and maxillofacial surgery. But then I also have a wider role in oral health for NHS England workforce training and education.
Amazing. So we have a very important topic today, and it kind of feeds into a lot of wider work which Sophie will explain about. So today we are going to be talking about mouth care. So Sophie, do you want to explain a bit about your project and things like that?
So you kind of might be wondering why infection control nurses are kind of interested in mouth care. Mm-hmm. Well, essentially we know that mouth care is very closely linked to hospital-associated infections such as pneumonia. Mm-hmm. And so that's what I'm really interested in. My big project is reducing hospital-associated pneumonia, particularly adult inpatient areas.
Oh, yeah, absolutely. Yeah, we have a lot of hospital-acquired pneumonia, and we do see a lot of issues with mouth care on a day-to-day basis. And obviously, there are loads and loads of other things to be doing, but this forms such an important and integral part of nursing care, just basic sort of maintaining people's dignity, everything like that. So it's such an important topic, isn't it?
Yeah, and one of the things we're looking now as a trust is brilliant basics. Yeah. And mouth care is 100% a massive part of this as well. Exactly. And everyone has such an important influence on this. Yeah. When we're doing our training, I kind of think of your own mouth care too, and your children or your grandchildren. Yeah. Mm-hmm. It's such a important thing for everyone, the whole community.
Yeah, absolutely. I think, again, when you're just thinking about if you're lying in a hospital bed and when you've got that kind of like woke up in the morning claggy kind of disgusting feeling in your mouth, imagine having that day after day and not even having the option to brush your teeth. I mean, as an example, like I just had a gentleman the other day that I went to go and see who had a toothbrush and toothpaste on the table right next to him, but he couldn't put the toothpaste on the toothbrush and he couldn't do it himself, so he needed help.
And people don't want to be a burden in hospital, do they?
Yeah,
so they're,
exactly.
I won't ask, it's just my teeth, it doesn't matter. And exactly. So it needs that reminder to get it done.
100%.
The research truly shows, and this is not just our trust, this is across all NHS trusts, that when patients are admitted to hospital, their oral care and their mouth care does deteriorate. And anyone knows any good QI project, you need all your incredible stakeholders in. Absolutely. So this is why we've got fantastic Harriet as well involved with this awesome project. So Harriet, talk us through the links between mouth care, pneumonia, and just why mouth care deteriorates while you're in hospital.
So I think, like you said, Sophie, the research really shows that anyone coming into hospital, their oral health really deteriorates. And that can be for a variety of reasons. But I always like to kind of explain to the patients I see that the mouth is like the opening to the rest of the body. So when we're breathing, we breathe through our mouth. When we're eating, everything passes through the mouth first. And the mouth is disgusting. Even a clean mouth is vile. It harbours more bacteria than a public toilet seat, which is, I don't like to think about that too much in my job, because I think, is my PPE adequate? But it definitely is. And so I think, everything that enters the mouth has the potential to enter the rest of the body as well. And like you're saying, the links between mouth care and hospital-acquired pneumonia, especially, if you're breathing in through a dirty mouth and you have an inadequate swallow, you're aspirating, all of that bacteria is going to end up in your lungs. And we all naturally kind of aspirate a little bit of saliva, like when we're sleeping, but in a healthy person, it doesn't cause a problem. But if your immune system is a bit low and if you're in hospital, there's something going on, it's going to cause loads of problems. And it's kind of scary, I think. But I think this also as a dental professional, that it's really easy to prevent. It's not, like you said, brilliant basics. It's not doing surgery and complicated things. It's toothbrushing. And I think the trust, what you're doing in the trust is fantastic as a building block to improve everything.
I think, I guess just to note on that side of things as well, I mean, if you're getting a pnumonia, you're going to have IV antibiotics to treat that.
Yeah.
You know, you're going to be in hospital longer, roughly 8 to 11 days in bed, you know.
Exactly.
You know, deterioration there, mobility, all these sorts of things, healthcare costs, healthcare economy costs, you know, nursing time,
antimicrobial
patient flow. Yes,
so
perfect.
We're feeding into all aspects here, really, aren't we?
I think also, like you said earlier, Fran, that we've all experienced that waking up in the morning and your mouth just feels horrible. That doesn't make you want to eat or drink anything. So patients lose weight because they think, oh, my mouth feels vile. I don't want to eat because it's disgusting. And again, that's all that bacteria passing into the rest of the body. And I think there's so much research into not just hospital-acquired pneumonias, but other links between oral health and general health as well. They found specific oral bacteria in amputated toes of people with diabetes. And I think you can't get further from the mouth than to your toes, can you? So it travels everywhere.
Wow.
Gosh, that's absolutely incredible to
Yeah,
hear about.
that's insane.
But I also guess it's kind of, you know, working out who are our high-risk patients.
Yes.
You know, there's patients who could be completely independent like us. They've come in as emergency, but maybe they've forgotten their toothbrush and toothpaste. They don't want to bother us, you know. We need to make sure they've got that equipment. Then you've got patients who are, you know, nil by mouth. Again, really important that they continue that oral health. And maybe they're about to go for surgery. The surgery gets cancelled, then they're not maybe, you know, for maybe quite a few days.
Absolutely.
And then we've got our patients who need, you know, full assistance in oral care needs. And these people, just to note, the mouth care plan is still on paper, hopefully EPR, fingers crossed. But just, you know, particularly in our trust to look out for that we want to see that documentation on the paper. There's a Halstead score there, you know, that'll guide you of what to do. But, you know, when we're looking in our patients' mouths, is there any things that we should be looking for, and where do we escalate them to? And
I think that's a really pertinent question given the challenge of access to dentistry, which is a whole other 5-hour podcast for another day. But I think it is really important that actually for a lot of patients, having a health professional in hospital look in their mouth might be their only opportunity for someone to look for any abnormalities for quite some time. And that's not to say that all health and social care staff need to be experts in identifying oral cancer, but just having an awareness of what's normal, what's abnormal, and knowing how to escalate that. And just like, you know, in dentistry at the moment, there's that really sort of kind of cheesy phrase of making every contact count. But if we can do that in hospital as well, we will ease the burden on NHS dentistry as well. And medicine and dentistry need to work together more, and I'm really delighted that you can definitely see that starting to happen. So anything that looks out of the ordinary, which is such a sweeping statement, but that doesn't look quite right, your gut instinct is usually pretty good. I always think sort of like looking methodically is a really good idea, but people often miss looking in under the tongue, and that's a really common sight for things like mouth cancer. So really important to look everywhere with a light source. I've witnessed staff on wards, not in this hospital, do a really, really thorough mouth care assessment in the dark. And I think, how can you see anything?
All right.
I was pleased this morning when I met up with a colleague at another hospital and she had multiple pen torches in her pocket. I was like,
we can
amazing.
Well, branded.
Nice.
Pen torches are going through CPEG at the moment.
Amazing.
Reviewed.
Sounds good.
Yeah.
So what, I mean, just from my understanding, because I know that you've explained the products that we have available in the trust before, and I obviously know of them, but I feel like there are quite a few that are so helpful, but I don't always understand the ways that they do help. So what products are available in the trust?
Definitely look on the intranet pages under the Mouth Care Ambassador section. Always welcome to email me anytime too, because I can always send these out to people. There's also a guide in the Swan box as well. So you might have remembered we were using pink foam sponges for quite some time. They are now gone as of maybe, I think, 5 years ago. Finally.
I did find a rogue box last year and I was like, I've got to get rid of this and like take it off.
Did you have a ceremonial burning?
I literally didn't know what to do with it, so it's still in one of our offices because I don't know what to do. But we're going to get rid of it. I mean, need to, because I just had to get it off that ward. So if you see any, get them out. So,
So, I mean, I'll briefly mention the products, but I tell you what, Harriet will probably be able to go in more detail to them. But, you know, a pink foam sponge can't remove any plaque. You know, a toothbrush can do so much great stuff. So obviously we have toothbrushes in the trust. Ideally, you want to have the paediatric toothbrush because it's smaller, you know, for maybe if the mouth is painful and things like this. So like the pink foam sponges, you could use that for hydration, but definitely brushing teeth. But I would use a different one from what you'd be, you know, brushing teeth with to maybe one you'd use for hydration, or a dry mouth gel and things like this. And you spoke about PPE earlier. So from infection control nurse point of view, PPE, you're touching a mucous membrane, you want to wear gloves and apron for this. And if you think there's going to be splashes, then you want to wear a visor as well. So we do have the 360 toothbrush as well. Again, you could get the paediatric version of this. I know it's a little bit cheaper. The Mouth Ease Oral Cleanser. There is a new SLS-free toothpaste that's just arrived into trust. You can get hold of this. That's for maybe anyone who's nil by mouth or has mucositis. It's tricky. I don't want to go into too much detail because you know I want to keep it short and sweet. Also, tongue depressors are currently going through CPEG as well to work out which one would best suit our trust. So there's loads of mouth care products out there, but you are right, it's kind of finding the right one for the right action you're going to be doing. But there are lots of good videos as well on the internet pages too.
I think just one thing to mention with products, obviously like dry mouth gels, I think are probably the ones that I've seen most commonly misused. So I think people suffer with a really dry mouth and people want to help, so they think, right, the more I use, the nicer it will feel. And it's unfortunately the total opposite. So the smaller amount really rubbed in, like if our skin felt dry, we wouldn't just slather on a load of cream and not rub it in, like the body's not going to absorb that. So to rub it in like you would on the skin, just really gently and thoroughly, and people will feel so much more relief. I see patients downstairs all the time, I don't like the dry mouth gels, they don't work. You ask how they're using them and they're using half a tube a time and it's all gunking up. And they return after some education and it feels better. So the small, and that saves money. You know, I think we all have to kind of be a guardianship for finances as well, and if you use products appropriately, they shouldn't be a burden to finances, should they?
Yeah, absolutely. But I would say equally in hospital, you know, if it doesn't look good, change it. You know, we know hospitals aren't the most amazing clean places. You can't store your toothbrush and equipment as nicely as you would. You know, you don't want to be using a hand hygiene sink. You want to be using the bathrooms. Again, you know, when cleaning dentures, not in the sink, in a cardboard bowl.
Also, partly, definitely, obviously, from an infection control point of view, but if you drop a denture in a ceramic basin, it's going to break, and then they take forever to remake. That's someone not eating. You know, it's undignified for a lot of people to not wear their dentures. If you drop it in a cardboard bowl, it's not going to break. So you're safeguarding the denture as well. So
absolutely. I mean, you said about, you know, if the dentures are broken, the knock-on effects of that, you know, eating, drinking. But, you know, your dentures and your teeth form the shape of your mouth. You know, it's your dignity, you know, particularly at end-of-life care. And, you know, having a really comfortable mouth and, you know, that smells nice and feels comfortable is so important, right?
Definitely. I think that's a huge thing with mouth care in general, but especially at the end of life, is we focus a lot on the links between mouth care and acquired infections, etc. But so much of it is important for the relatives as well as the patient. So if you have a patient who's perhaps unconscious, you don't want to go and kiss a relative and their breath is vile, because that's your lasting memory. So I think it's our role to safeguard relatives or loved ones as well, to really, you know, if the breath feels nice and fresh, they're going to enjoy it and feel they can say goodbye or give that emotion, I guess.
Exactly. So I feel like particularly in, say, end-of-life patients, if they have family members there, people that they're comfortable with, that can assist them, carers, getting them involved in, say, mouth care, even at end of life, just making them feel comfortable as well. And also thinking about patients potentially with resistant behaviours, if they have somebody there that they feel comfortable with, that maybe they can help out. Obviously, sometimes this helps to relieve a bit of a burden on healthcare staff, but obviously makes patients feel more comfortable that they're having this this sort of self-care done by somebody else helping them. So hopefully that will be another thing to consider in those scenarios, I think.
Oh yeah, absolutely. Family involvement is so key, right?
Yeah, definitely. Yeah, because it can do so much, and obviously not just in mouth care, but in every single aspect. But I think again, like with a lot of things, mouth care probably comes last on people's lists because they're thinking about like the whole bigger picture, even though it's such an integral part of the bigger picture in a way.
Yeah,
So
definitely.
So I guess if we're thinking about in hospital too, you know, if a patient you feel like there's thrush or they're experiencing dry mouth, definitely this is when you be kind of escalating to your doctors. I know, Harriet, you're in MaxFac, so is, as you said about oral cancers and things like this, then, you know, there's always that referral.
Yes, yeah, definitely. I think, so I would like to say on that point that it is really overwhelming to look in the mouth and think, okay, this is my one training session. What on earth does the mouth look like? Yeah. We know it's not routinely taught in depth at medical school, nursing school, AHPs, healthcare support workers. You know, we're starting to change that, but, you know, it's a big mountain to climb. So I think it's always, you know, everyone would rather that something was checked to be found that it was normal than people were scared to make a referral and then it was something sinister. And even as a dental hygienist, I don't feel I know what every single mouth cancer looks like ever. But it's about working as a team and getting colleagues in for second opinions. And I'm fortunate that I've never been made to feel stupid for doing that or asking the patient. I had one situation when I very first started in a different hospital where I was on a ward and I was looking at something in the mouth and I was thinking, oh no, this is awful, this is terrible. And I didn't think to ask the patient if they knew it was there. And the consultant came and the consultant looked and they were like, oh, I think they've just bitten their lip. And I asked the patient, she said, oh, I did that yesterday on my cottage pie. And I was like, if only I'd have asked, like, it would have saved so much work for the consultant. So your patient is your best knowledge source, aren't they? So, yeah.
So, Harriet, if you had to give like a top 5 tips for, you know, inpatient adults, what would be your top 5 tips?
Firstly, document it, I think. So if someone comes around and does an audit and it's not documented, even if you know you've done it, we have to mark that it hasn't been done. Effective toothbrushing is really key. Marketing in dentistry is really clever for water flossers and ultrasonic scalers. You can clean your teeth at home, and they're all expensive nonsense.
That's good.
Sorry.
No, my mum would agree.
Good, that's
my mum would
good.
definitely agree.
I'm pleased you said that. Effective toothbrushing with, like you said, a small-headed toothbrush like a baby toothbrush with appropriate toothpaste that's got fluoride in twice a day, last thing at night and one other time. I think people get really caught up on mouth care first thing in the morning, but it's often a really busy time in hospital. It's the ward round. There's loads of stuff going on. Do it at 10 a.m, at 3 p.m. As long as it's done at one other time, that's fine. I've lost how many tips I'm on.
I think that was number 3.
Okay, number 3. Number 4, I think, would be encourage independence as much as possible. And I think number 5 would be mindful that not everyone knows their loved ones wear dentures. So to not... you know, just to be very careful about letting loved ones see people without their dentures in and kind of taking responsibility for making sure the dentures are clean, etc. So it's not a highlight. My father wears a denture, I didn't know.
You know, I never even think about that. That's never even occurred to me in my life.
Yeah.
Okay, interesting.
I mean, denture cleaning, I could go on all day about that again. Definitely refer to the Mouth Care Matters internet pages for that. Really
Can
great
I have a
video on
6th
there as well.
tip?
Yes.
Okay,
definitely.
thank you. I'm going to be like at number 15. Don't brush dentures with toothpaste. It happens all the time, but it abrades the material of them, which harbours more bacteria, which is obviously teaching infection control nurses to suck eggs here. But yeah, not good. So just soap and water is absolutely fine. So with dentures, try not to let the patient see that you're brushing their dentures with soap and water, because they really don't like to see it. I don't know if they think they're going to foam at the mouth, but do it kind of with your back away.
And just to note, the soap that's in the pump at all the sinks around the trust, that's absolutely perfect. I have checked it in the past, and that's
Good to know.
what you can use, which is good.
But not in a hand washing sink.
Not in the sink.
Yeah.
So I guess I just want to do a really big shout out to all the Mouthcare Matters team that are working around the trust. There are some really incredible people that I just want to give a quick shout out to. For example, Paula Hemming, who's an ACP in Haematology Oncology, Maria McPherson, a DCC sister, the speech and language team, and all the fantastic dental nurses within MaxFax too, who are really plugging good oral health and mouth care within the trust. If you are interested in being a part of the mouth care and pneumonia stakeholder team, then please get in touch.
Yeah, also thank you to Sophie, because Sophie does so much work on this. I don't think I've ever seen someone work so hard on something in my life. And Sophie does so much work on it, and she's very knowledgeable on all things mouthcare related.
I agree with that.
Well, this is why you need, a big stakeholder team, isn't it? It's everyone's involved. Everyone, has to be involved with this, really.
But I think, you recently organised the county-wide Mouthcare Study Day. That was such an incredible event to bring people together. And, I think round of applause for Sophie.
Thank you. Again, sorry, on that front, actually, the partnership. So it's a county-wide mouthcare partnership. We're aiming to have all our service users and patients to experience the same level of mouthcare assessments and products, no matter what healthcare service they're within Gloucestershire. So that's another awesome thing. So if you're again interested in that, please drop me an email.
Yeah. Well, thank you both for coming on the podcast today. It's been really interesting. I've sort of taken a back seat on this one, finding out some new stuff, definitely for me. But as always, you can contact us on our extensions 6122 for Gloucester and 3129 for Cheltenham, and our email address in the address book. So thank you, Harriet, for coming in very
Thank you
especially
for
for this.
having
It's
me.
been amazing. And thank you, Sophie, as well. It's been really fun. And we'll see you next time. Bye.
Bye.
Bye.